I'm Dwayne Brown. Tonight on KPBS Evening Edition, as President Obama calls for a stepped-up response to Ebola, California nurses say they need more training and gear to deal with the disease if it turns up here.
I'm Peggy Pico. The pre-election battle over Proposition 46 is one of the most contentious and expensive on the November ballot. The three basic provisions and who's for it and against it. Also ahead, are you an influential Twitter user? Do you know someone who is? Why San Diego County's Office of Emergency Services wants to know, and how you may be asked to help in a disaster.
Early voting is underway for the November election. We'll have a look at where folks have already cast their ballots. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. President Obama is promising a much more aggressive response to the Ebola crisis. A second nurse has been diagnosed with Ebola in Dallas. She had also treated Thomas Eric Duncan, who died last week. The president says he's directed the Centers for Disease Control to step up its response with teams on site within 24 hours of an Ebola diagnosis. California health officials are trying to calm fears, saying there are no cases here. Healthcare workers are said to be at most risk for contracting Ebola, and the California Nurses Association says its members haven't gotten the training they need to deal with Ebola patients. They also say their safety gear may leave them at risk. PBS NewsHour will have more on the Ebola crisis coming up at 7 tonight. The city of San Diego has approved its first legal medical marijuana dispensary. It will be located in a one-story commercial building on Roll Drive near Brown Field in Otay Mesa. About a dozen people applauded the decision by a city services hearing officer in council chambers. San Diego becomes the last major city in the state to regulate medical marijuana, approved by California voters almost 18 years ago with the passage of Proposition 215. Dr. David BLAIR is CEO of a Green Alternative, the nonprofit that applied for a permit back in late April to legally sell marijuana for medical use.
We're at the end of the beginning and the beginning of the next step.
The group still faces a 10-day appeal process. Back in March, City Council approved a set of restrictive zoning regulations near houses, schools, and churches, allowing up to 4 collectives to legally operate in 8 council districts, excluding downtown, Hillcrest, and North Park. Dr. BLAIR also uses cannabis as medicine and says having a dispensary in town is a welcome change from when he got his first prescription back in 1996.
There was one dispensary in Los Angeles, and I would have to buy enough product to make sure I wasn't driving there more than once a month.
The mayor's office says the permit process could cost operators up to $100,000. BLAIR says a Green Alternative could be open in Otay Mesa sometime between Thanksgiving and Christmas. The first dispensary considered legal by the county recently opened for business near Gillespie Field. San Diego's police chief says all her patrol officers will have body cameras by the end of next year. Shelley Zimmerman spoke to a community panel about the cameras last night. Cameras are meant to increase the accountability of officers and address racial profiling. The chief says so far officers like the cameras.
I make a point every week to talk to the officers that have these cameras, and I ask them how it's going. Now, in every case, the officers have said that they have not had any instances where they wish they didn't have it, and there's been numerous times that they were so grateful that they had the camera.
Officers are required to record every time they make contact with a member of the public. If they don't, Zimmerman says they could be fired. City Council in Escondido is hearing an appeal over a proposed shelter for children caught crossing the border illegally. A government contractor wants to open the shelter in a former nursing home in a residential neighborhood. Planning Commission has already rejected the proposal, but the contractor is asking Council to take a second look. Tomorrow morning, 10 million Californians will practice how to drop, cover, and hold during an earthquake. The Great Shakeout is an annual statewide drill set for 10:16 tomorrow morning. KPBS reporter Susan Murphy talked to a seismic researcher about San Diego's active faults and the risk of a large quake.
It has been 214 years since a major earthquake struck San Diego County. A magnitude 6.5 quake jolted the region on November 22, 1800. Since then, shaking has been relatively quiet, with the exception of some distant quakes, including the Easter earthquake in Mexico in 2010. But the county is surrounded by active faults capable of unleashing large quakes up to magnitude 7s. Thomas Rockwell is a seismologist and professor of geology at San Diego State University. He says a major slip along the Rose Canyon Fault is the region's #1 threat. That's because it cuts through the heart of the city of San Diego, stretches across La Jolla, and continues north along the coast. Rockwell and his team recently excavated a section of the Rose Canyon Fault in Old Town to study prehistoric earthquakes.
We found that we had more frequent earthquakes on the Rose Canyon Fault than we had thought. So it looks like the average recurrence interval was more like 500 to 1,000 years on the Rose Canyon rather than 1 to 2,000 years.
A major quake on the Rose Canyon or other nearby faults could cause significant damage and cut off water supplies, electricity, and transportation. Holly Crawford is director of San Diego County's Office of Emergency Services.
If it happened at 5 o'clock and we had the maximum credible earthquake along the Rose Canyon, we might anticipate somewhere around 57 deaths, is what the modeling shows. Displaced households, somewhere around 5,000.
Crawford urges residents to prepare for the next quake by creating a family emergency plan and registering their mobile phones with the county's mass notification system at alertsandiego.org. Susan Murphy, KPBS News.
If we get a real earthquake, influential Twitter users could play an important role getting emergency information out to us. Peggy Pico talks with the researcher working on the plan.
San Diego County Office of Emergency Services is teaming up with SDSU's Center for Human Dynamics in the Mobile Age to reach out to 1,000 local Twitter users in hopes of getting important disaster information to more people. My guest, SDSU geography professor Ming So, is director of the Center for Human Dynamics. And welcome back, Dr. So. The Center for Human Dynamics in the Mobile Age, they actually tracked Twitter use during the most recent wildfires. What did you learn?
Yeah, we started using the API to analyzing those tweets during the summer wildfire. And what we find is interesting is those tweets actually come from the area, actually when the activity is going on the wildfire perimeter. And so the hotspot is actually is corresponding to actual fire perimeter.
So the hotspots of Twitter users were corresponding to the actual hotspots of the fires in the perimeter there. In this new project, you actually want to engage 1,000 influential Twitter users here locally to help broadcast this important information, let's say, during a disaster. What makes them influential, and what would their role be in this?
Yeah, I think the way we communicate in the social media is different from the traditional message or the channels. And because the social networks, so the most powerful people in social media is the people has a lot of followers, a lot of retweets. So we are using those computational algorithms, try to analyzing, like there's a 30,000 follower for the San Diego County official Twitter account. So we go through the list, analyzing, identify the ranking of those influential index. And after we identify the top 1,000 influential people, then we reach out, ask them for the volunteer to retweet.
How would this be different than what the county is already offering as far as Twitter accounts or Twitter alerts?
Yeah, right now the county procedure, or most of the government agency procedure, is a passive way. So they encourage people to subscribe their Twitter account, they get a message. But this platform is a very active behavior, active platform to recruit the volunteer, to identify the power of a social network, to disseminate. We want to accelerate the information distribution through the social network power.
It almost sounds like they'd be kind of team leaders on the Twitter universe that would kind of be responsible. And it's a volunteer situation.
Yes.
Walk us through the process. How would it work, let's say, during a fire?
So before the wildfire, we already try to use those computational algorithms to identify those 1,000 volunteers who has influential. But we also want to make sure they are in San Diego. So make sure, because only the people in San Diego has the maximum influential, not just on cyberspace, but in real world connections. So when the disaster happens, the county office of emergency service will send out the message, but we'll create a system to rebroadcasting the message to those 1,000 followers, ask them to retweet it. And the system will actually monitor whether they did retweet or not. It will send a reminder. And also to monitor how these retweets reach out to other people. So we have a performance evaluation index.
I know, and that brings me to my next question. We've seen in the past that early details during a disaster are often incomplete or sometimes actually incorrect. How is the county going to track that? Is it going to be similar to tracking the retweets?
Yeah, so actually the whole system is a two-way. One is to disseminate information, distribute through the volunteer work. The other one to receive or monitor information from the whole county of San Diego during the disaster. So the system, we're going to identify the top 10, the most popular URL retweets during the disaster. Then the officer can go through the list to see which one is correct, which one is incorrect. And if we find out incorrect information, they can have an update immediately.
They can correct it on the spot. What about people who don't use Twitter? We know Twitter skews young, under age 25. So what about seniors, grandparents? What about, are they going to be left out?
No, actually, there's one component in the project is we were trying to reach out those health providers or the caregivers and try to introduce our new system to these people, to the nursing home, to the hospital. And then so hopefully they also be part of our network system. But also another aspect is when we recruit these top 1,000 volunteers, they are young generation of people, San Diegans. They are the future of our community. And this platform will encourage them to play a very active way to participate our community, become the protector or scout for those senior people.
And hopefully they are close to their seniors and their families and might actually send those messages to them as well. How soon will the county be able to begin this program?
Yeah, so the project just started 1 month ago, and this is a whole 4-year project. But we try to implement this prototype within 6 months. So hopefully before the next year summer, we should implement the system and we'll be prepared for the summer disaster or any kind of emergency situation.
All right. Well, Professor Ming So, keep us up to date on that. Thanks so much for joining us.
Thank you. My pleasure.
Qualcomm is spending $2.5 billion cash to widen its scope in connected cars and smart devices, an area becoming known as the Internet of Things. Qualcomm is buying the British semiconductor maker CSR. That company says the purchase will strengthen Qualcomm says it will strengthen its position in connecting homes, cars, medical devices, and much more. SeaWorld is losing another business connection. Virgin America is cutting its ties with the park. Bloomberg News says the airline dropped SeaWorld from a rewards program after getting pressured by animal rights activists. SeaWorld has long been a target because of its killer whale shows. The park says the change will have little effect because most tickets are sold directly and not through reward programs. There was a last call of sorts up in the North County, what's expected to be the last test of the warning system at the San Onofre nuclear plant. About 50 sirens went off this morning. The plant is being decommissioned. Early voting for the November election underway right now in San Diego. Joe Girardi with our media partner iNewsSource has been analyzing the return rate of early ballots in the tight 52nd district race. He joins us now. So Joe, how many early ballots have been tallied in the 52nd?
So far, the County Registrar of Voters Office has mailed ballots to about 218,000 voters. About 17,000 of those have been returned. That's about 8% of the early ballots.
Now, you actually built a map to track the return rate by precinct. Where are we seeing the highest returns right now?
Right now, precincts in Rancho Bernardo and Coronado are dominating the highest returning precincts. We're seeing return rates in the mid-teens in many of those areas, and early voting has only been going on for a little more than a week.
So, Joe, do we know how big a role early voting might play in this election?
It could be significant. In the 2010 gubernatorial election, about 55% of all votes cast were early ballots. In this past June's primary, about 73% of all votes cast were done so early. San Diego County Registrar of Voters Michael Vu said he expected voting in this election, early voting, to fall somewhere between the two, perhaps 60% or a little higher.
All right, I might be pushing it here, but can these early returns tell us anything about who might have the advantage heading into Election Day?
They can. Like I said before, only a relative handful of early ballots have been returned so far. But as we get closer to November 4th, return rates of early ballots can tell us which parts of town are most enthusiastic about voting. If we see Democratic strongholds returning their ballots at higher rates than Republican areas, Scott Peters is probably going to have a good election day. If it's the other way around, residents of the 52nd District may well have a new congressman come January.
And, of course, folks can go to inewssource.org to see the interactive map. Reporter Joe Girardi. Backers of Prop 46 on the ballot next month say the measure is designed to improve patient safety here in California, but opponents say it's really about putting more money into trial lawyers' pockets. KPBS health reporter Kenny Goldberg says the fight over Prop 46 is proving to be one of the most contentious in the fall election.
In 1998, former San Diego Deputy Mayor Bill Mitchell says he was the victim of medical malpractice. He was diagnosed with glaucoma in his left eye and underwent laser surgery to ease the pressure. The doctor sent him home with a list of 4 warning signs to look out for. 2 weeks later, Mitchell had pain in his left eye.
So I ran to the mirror and I noticed it was red and a discharge and I was losing my vision.
These were the warning signs Mitchell was told about. They indicated a medical emergency. Mitchell immediately called his surgeon, but it wasn't until later that afternoon that he actually saw him.
When he took one look at me, he hurriedly took me over to the retina department, and they inserted 18 shots of antibiotic into my eyeball.
Mitchell was left legally blind in his left eye. He went to 16 different attorneys to try to find someone to handle what he felt was a strong malpractice claim. But Mitchell says because of California's $250,000 cap on pain and suffering damages and malpractice suits, no one would take the case.
When you start talking penny ante money where they'd get half of the $250,000, that means $125,000. It isn't worth their time.
The California legislature approved the cap on pain and suffering damages in 1975 in an attempt to lower the price of malpractice insurance. Prop 46 would raise the cap to $1.1 million and index it to inflation. The measure would require random drug testing of doctors, and it would mandate physicians who prescribe narcotics to use the Cures system. That's a statewide database that can indicate whether a patient is doctor shopping for dangerous drugs. Proponents say Prop 46's 3 elements would enhance patient safety. But it's the idea of raising the cap on malpractice awards that's drawing most of the attention.
The real story behind Proposition 46? Start with the trial lawyers. They wrote and paid for Prop 46. Why? Pretty simple. To make millions from more medical lawsuits and higher jury awards.
Dr. Robert Wales is a specialist in pain medicine and is former president of the San Diego County Medical Society. He's a staunch opponent of Prop 46. In fact, he's put no on 46 signs all over his Encinitas office. Dr. Wales says lifting the cap will drive up the cost of malpractice insurance.
That cost is going to be passed on to all of us. It increases the cost for health care.
Wales says if malpractice insurance rates go up dramatically, some doctors will be forced to close their doors.
So access to care will be a real issue because of this. And we don't want to decrease access to care in a time like this when we're trying to expand access to care.
Carmen Balber is executive director of the nonprofit Consumer Watchdog. Her group is the driving force behind Prop 46. She says the No on 46 campaign is funded primarily by malpractice insurance companies. Collectively, opponents have raised more than $56 million to defeat the initiative. In contrast, supporters have amassed about $7 million. Balber says arguments against the measure are just scare tactics.
The last thing the insurance industry wants to do is play a fair game and say, well, what we really don't want to do is allow a few more families to go to court and hold dangerous doctors accountable.
Balber says changing the nearly 40-year-old cap on pain and suffering awards is central to Prop 46.
But the other pieces are too, and that's because deterring substance abuse, whether it's by physicians or patients, and deterring medical negligence is going to save lives across the board.
A study in the Journal of Patient Safety estimates more than 400,000 Americans die each year as a result of medical mistakes. A field poll in early July showed 58% of likely voters were in favor of Prop 46. That support had dropped to nearly 34% by early September.
KPBS health reporter Kenny Goldberg joins us with further insight into Proposition 46. And Kenny, briefly recap for us the three provisions to this measure.
Well, Prop 46 would raise the cap on pain and suffering damages from $250,000 to $1.1 million and would index it to inflation. It would also require doctors to have random drug and alcohol tests. And lastly, it would require doctors who prescribe narcotics to their patients to use the Cures database, which is a statewide database that can tell if a patient is doctor shopping for dangerous drugs.
Now, one of the most controversial provisions is, of course, this cap, raising this cap up to $1.1 million. The doctor you interviewed in your story said that that would increase medical insurance cost. Have you found anything out about as far as evidence that it really would raise this?
Well, I spoke to a couple of different health economists, one at Harvard and one at UCLA, and they both told me there's no evidence that there's any relationship between the cap on pain and suffering damages and malpractice insurance rates. There's also no evidence to show that any kind of cap on malpractice insurance rates or the actual price of malpractice insurance has any bearing on overall health care costs. So the claims of people against Prop 46, they evidently don't bear out.
Yes, and so as you said, the overall medical costs, that there's no evidence so far that actually expands out. But you also interviewed Bill Mitchell in your story, and he said he couldn't find an attorney who would take his medical case and take that to court. Is that typical? Is it difficult to get a medical malpractice case covered by an attorney?
It is, because their fee is based primarily on a percentage of that pain and suffering damage award. And when it's capped at $250,000, supporters of Prop 46 say it's tough for people to find an attorney who's willing to represent somebody in a medical malpractice case.
And just touching on that cap one more time, how do other states handle it?
Well, some have the same kind of caps, some have higher caps, and the cap on medical malpractice pain and suffering damages have been ruled unconstitutional in 6 states, most recently in Florida.
So the different states handle it differently, but still at the $250,000 here in California. Now, another provision of Prop 46 would require doctors, as you said, to use this Cure statewide database before prescribing prescription drugs or
prescription narcotics.
Pain narcotics, right, to patients. So basically, what are the doctors or opponents saying why they're against that?
Well, the Cures database isn't fully operational. It was almost totally defunded about 1.5 years ago, and then the legislature jumped in and appropriated some more money for it. The Cures database is being upgraded as we speak, and even advocates of using the Cures database admit it won't be fully operational till at least late 2015. So it can't handle the current number of requests, and opponents are saying there's no reason it would be able to handle even an increased number of requests.
If this measure passes, California would become the first state to require doctors to have random drug testing. What is the California Medical Association's take on that provision?
Well, the doctors I've talked to, they don't really address it per se, because they say it's just a smokescreen. And it's a smokescreen, they say, to cover up this desire to heighten the pain and suffering cap, which is written by trial attorneys. So they say it's sort of an insidious smokescreen to try to divert people's attention away from the real goal of supporters, which is to change that cap.
And how about in the San Diego medical community? I know you've spoken to quite a few doctors on this. What is their take overall on Proposition 46?
Well, they're totally against it, and they fear that it will raise malpractice insurance rates and therefore put doctors under the gun financially.
All right, KPBS health reporter Kenny Goldberg, thanks so much for the update on this. And I want to let folks know that you can see more of our election coverage on this and other measure items at kpbs.org/election.
I'm Gwen Eiffel. On the next News Hour, we sit down with Treasury Secretary Jack Lew and Budget Director Sean Donovan to discuss the nation's economy. That's Wednesday on the PBS News Hour.
If you like today's cooler weather, you can look forward to more of the same in our forecast. Coastal temperatures in the mid-70s tomorrow, a little cooler as we head into the weekend. Low to mid-70s for the inland valleys. Sunny in the mountains, upper 60s there. And for the desert, low 90s with a mix of sun and clouds. You can find tonight's stories on our website, kpbs.org/evening edition. Thanks for joining us. Have a great night.